Signs of vitamin D deficiency. Vitamin D, often referred to as the sunshine vitamin, plays a crucial role in various physiological processes within the body, including bone health, immune function, and mood regulation. Despite its importance, vitamin D deficiency is prevalent worldwide, affecting individuals of all ages and backgrounds. This review aims to explore the signs and symptoms of vitamin D deficiency and their implications for overall health. Through an analysis of scientific literature, epidemiological studies, and clinical observations, this paper seeks to raise awareness about the silent epidemic of vitamin D deficiency and highlight the importance of prevention and treatment strategies. Overview of vitamin D and its significance for human health. Prevalence of vitamin D deficiency globally. Objectives of the review: identifying signs of vitamin D deficiency and their impact on health. The role of vitamin D in the body. Functions of vitamin D in calcium absorption, bone health, and mineral metabolism. Regulation of immune function, inflammation, and gene expression by vitamin D. Influence of vitamin D on mood, cognitive function, and overall well-being. Common signs and symptoms of vitamin D deficiency. Fatigue and generalized weakness. Understanding the role of vitamin D in muscle function and energy metabolism. Bone pain and increased fracture risk, linking vitamin D deficiency to osteomalacia and osteoporosis. Muscle cramps and joint pain, exploring the relationship between vitamin D levels and musculoskeletal health. Impaired wound healing, recognizing the importance of vitamin D in immune response and tissue repair. Hair loss and alopecia, investigating the potential role of vitamin D in hair follicle function and growth. Depression and mood disorders, examining the association between vitamin D deficiency and mental health conditions. Increased susceptibility to infections, understanding the immunomodulatory effects of vitamin D on innate and adaptive immunity. Impaired cognitive function, exploring the link between vitamin D status and cognitive decline in older adults. Decreased bone density, assessing the impact of vitamin D deficiency on bone mineralization and density. Chronic pain and fibromyalgia, investigating the role of vitamin D in pain perception and inflammatory pathways. Hypertension and cardiovascular disease, exploring the relationship between vitamin D deficiency and cardiovascular risk factors. Dental issues and periodontal disease, examining the effects of vitamin D on oral health and gum disease. Compromised immune function, understanding the role of vitamin D in modulating immune response and reducing inflammation. Respiratory infections and asthma exacerbations, investigating the potential benefits of vitamin D supplementation in respiratory health. Risk factors for vitamin D deficiency. Inadequate sun exposure, understanding the importance of sunlight in vitamin D synthesis. Darker skin pigmentation, exploring the impact of melanin on vitamin D production and absorption. Age-related changes in vitamin D metabolism, assessing the risk of deficiency in older adults. Obesity and adipose tissue storage, investigating the role of adiposity in vitamin D sequestration and bioavailability. Malabsorption disorders and gastrointestinal conditions, understanding the impact of gastrointestinal health on vitamin D absorption. Medications and drug interactions, identifying medications that may interfere with vitamin D metabolism and utilization. Diagnostic evaluation and treatment strategies. Laboratory tests for assessing vitamin D status, serum 25-hydroxyvitamin D25, OH-D, levels and reference ranges. Recommended daily intake of vitamin D, dietary sources, supplementation guidelines, and sun exposure recommendations. Pharmacological interventions for correcting vitamin D deficiency, oral supplements, intramuscular injections, and prescription formulations. Lifestyle modifications to enhance vitamin D absorption and utilization, sun safety practices, dietary modifications, and weight management strategies. Summary of key findings and implications for clinical practice. Importance of early detection and intervention in preventing vitamin D deficiency-related complications. Future research directions and unanswered questions in the field of vitamin D research. By recognizing the signs and symptoms of vitamin D deficiency and addressing underlying risk factors, healthcare providers can play a crucial role in improving patient outcomes and promoting overall health and well-being. Subscribe for more videos.